Hello everybody, Dr. Randy Wurts in Thrive Chiropractic. Hey, chances are, if you're watching this, you probably suspect that there's something going on with your disc. And a lot of people will call this a slip disc, which your actually disc does not slip. It's actually very firmly attached to the bones. But it can have damage and it can irritate your back as much as possible. But in many cases, you don't have symptoms of a disc problem until you really injure it pretty good. Or it's gradually wearing and tearing over a period of time. So, hey, let me explain different types of disc injury before we go on much further. So I'm going to use the jelly donut analogy, and people get this because most of the time they have jelly of donuts, but don't hold it against me as a healthcare professional that's talking about jelly donuts. So, a lot of people have jelly donuts. Now, around the outside is what keeps the jelly in, and just like your disc, there's a fibrous layer that keeps it, really the jelly part of your disc held in, and the jelly part is like the cushion. And what happens is when you start to get a disc bulge, it's actually pushing out on those outer parts. It doesn't come through yet, but it's actually pushing parts. When you get a disc herniation, it's like when you get a tear. And that's where, if you were going to look at the jelly donut, you would see that there's opening and you would be able to say, hey, yes, that's red filling in there, and you can actually see a tear in the disc part. So, and those can be very painful. Especially if they're irritated, next to the nerve. It's causing inflammation. It gets really painful when you start to have a protrusion where some of the jelly starts to come out, where the inside of that disc actually starts to come out, and it causes some irritations with the nerve there. And then, in those cases, I'd say like 50% of the people that I've seen in those cases, sometimes maybe 50% go to surgery. Depends on how bad it is, how chronic it is, what we can do to get it taken care of. But it's not an end all to be all. I had a lot of cases where you didn't have to have surgery. After we sent a person to an MRI, we found out they had a protrusion. Let's work on you. And they start coming out of this pretty good, as long as they're careful with things too. Now, a disc extrusion is totally different. Surgery is most likely needed in this case, because this is the part where some of that jelly, this is the part where you bite down on the jelly and it gets on your clothes. Well, this is the part where you have part of the disc actually get into the spinal canal and actually break off, and it actually pushes up against the nerves, and it's irritating. Now, these people, they almost cannot walk. Their legs become very flaccid, very painful to them, and they need a surgery pronto. There's other things. They might lose bowel movements in some cases because of just the nerves that it affects. So you have to be careful about this. So another way to really confirm a disc issue is an MRI. Now, once you have a disc issue, you really have to be careful, because the disc does not have blood vessels around it, and once those blood vessels get in there, it starts to make it weaker too. So what are some things you can do to keep your disc healthy? First of all, you gotta move. Discs get their nourishment because they move, and they're like sponges. So if you're squeezing a sponge, no water can get in. But likewise, if you set the sponge in water and it's not moving in and out, no new water is getting in. It becomes stagnant. So you need that pumping action, because the nutrients come from above and below the bones. It doesn't get a direct blood supply. They become squishy, okay? And they need to move. So if you have a joint that's locked up in your back and it's been that way for a while, that disc is not getting the nourishment it needs, and it slowly starts to decay and gets thinner and thinner and thinner. You get degeneration in your spine, and that's when you have all kinds of issues. So keeping your spine moving, not just the whole spine, but each individual joints, is important to do that as well, okay? So that's a big thing. If you're having some issues, avoid sitting for long periods of time, because that really compresses the disc, especially bending over and twisting. You're compressing the disc, and then you're taking a washcloth and like twisting it, so it's hard to do. And don't lift in this manner as well. It really has an effect on your disc and your spine. That's a no-no. In my book, that's a no-no. So keep the joints moving, keep the spine moving, keep your body not sitting for long periods of time, because that will have a compression on the disc. Watch how you bend over. Bend with your legs, not your back. Take care of yourself. And if you do have issues, if you suspect it's an issue, by all means, let me know. There are actually certain chiropractors that actually take care of disc issues in your spine, so you can get the help that you need. Hey, if you have any questions at all, please give us a call. We'd be glad to help. Take care. Bye.